I'm Dr Chi Chi Obuaya, Consultant Psychiatrist. I work in the NHS and I'm also in private practice here in London. The two go hand in hand. Therapy is an opportunity for people to explore areas of challenge in their life and to develop techniques that might help them to overcome those challenging areas. The church is a community where people can find their identity. It's one of the resources people can rely upon during times of adversity. It's all about culture. Churches have a huge role to play in tackling the stigma associated with mental health problems. But I think the starting point is really focusing on the basics. We know that stigma is a massive problem across the board when it comes to mental health problems, and the church is no different. People can feel really marginalized from their church communities because they might feel that there's a spiritual element to why they're struggling with their mental health problems. So it's so important that church leadership and culture is open and helps to validate the difficulties people might have with their mental health. It doesn't mean that churches have to have the expertise in addressing all the problems, but there's so much to do just in offering that care and compassion that sits at the heart of journeying with people who are going through mental health difficulties. It's definitely a double-edged sword. There can certainly be positive and negative aspects of the interplay between faith and people's mental health because they feel that there's a real virtue in what they're going through. This can be a double-edged sword because for some people, their faith can be severely challenged if they're not making progress with their mental health. So we need to be really careful in not drawing conclusions that it must have some spiritual explanation. Speak about it, identify help, and follow up. There is no expectation that if you know somebody that's going through mental health difficulties that you have to have expertise or be able to diagnose exactly what's going on. So having conversations is a starting point. I think then signposting people in the right direction. So just encouraging people to access professional help when there's clearly a problem. And I think then following up with them, that would be the last thing. Not just sending them on their way, but showing the care to find out how they're doing, checking in on them, and seeing if they've managed to follow through. The struggle is definitely real. We do indeed appear to be facing unprecedented challenges with respect to our mental health, and we're also developing a greater language in which you can express those difficulties. We know that for certain groups, the challenges are becoming more profound. So that can feel like a lot of bad news. I think the good news is that there has been a lot of work in tackling stigma. There's further work to do, but people are feeling able to come forward more so than they perhaps have in the past. The idea that it's okay not to feel okay and to seek help, I think is starting to permeate across society, and it's inevitable therefore that people will seek help from professionals, including their GP or mental health specialists.